So in today's class, we will just have a look on rickettsiasis. All right. Actually, this organism, they are in between protozoa and they are in between bacteria. In some literature, you can find that they are gram-negative bacteria, but in some literature, you will find that they are intracellular parasites. So the nomenclature is a bit hazy. Some Rickettsia like some rickettsial organism like Rickettsia are being studied in bacteriology class. Some rickettsial organism like Orientia Tsutsugomushi you might have heard, which is causing scrub typhus, and some Anaplasma, some Rickettsia, they are studying in protozoology class. So the nomenclature is quite hazy here. The nomenclature is not having a very clear cut. So anyway, we will just have a look on some of the important parasites, important organism, I should say, in livestock, which are causing disease in livestock. All right. Okay, so I have written down here, they are obligate intracellular parasites. As I told you that some nomenclature, some literature might cite intracellular gram-negative bacteria also. Okay, so here, this group of organisms, they are, many organisms are here, but we will focus only few from harmless endosymbionts or to etiological agents of certain most important disease. Okay, so these organisms, they are usually transmitted by the bite of an arthropod vector. Some transmit by lice, some transmit by mites, some transmit by ticks. Okay, so here in human, there are three groups that is classified. Okay, one is spotted fever group. Like you might have heard Rocky Mountain spotted fever, and you might have they might just give a nomenclature spotted fever. Okay, another one is typhus group or epidemic typhus, which is caused by Rickettsia prowazekii, and another last one is scrub typhus group, which is causing Orientia Tsutsugomushi. All right, so this Orientia Tsutsugomushi is also prevalent. It is prevalent in northeastern India and in different parts of India. There is one geographical uh, area, they called it as Tsutsugomushi Triangle. Right from Japan, if you just draw imaginary line, draw down to Australia, New Guinea, Papua New Guinea, and northern parts of Australia, and come to the northwest, to the Afghanistan and somewhere, there is some sort of triangle you can draw. Okay, so in that area, in that Tsutsugomushi Triangle, there is one parasite known as one organism, I should say, that is known as Orientia Tsutsugomushi. This is causing scrub typhus. Okay, it is having a long story. During Second World War, this organism was first detected. Before that, in Japan, in 1900 somewhere, they were detected, but nobody give attention about it. But during Second World War, when these American soldiers, they have come to Pacific Islands and all those places, they are in the bush, in the scrub, so they suffer from their this fever. They call it as pyrexia of unknown origin, PUO, pyrexia of unknown origin. Then they suffer, and many lives have been lost, and there are due to multiple organ failure. So the name was later on it was given to scrub typhus because the organism is being obtained or being contracted by the presence. If ever we go to scrub, okay. But after 1945, not much was reported, especially from Mizoram. But in 2008, from 2008 onwards, there have been a rise in the clinical case. Last year itself, in Tenzol village, they were around 170, more than 170 in the Tenzol locality, in that neighborhood. People suffer from this scrub typhus. Okay, so this organism is really interesting, and because why it have hidden down, it was hidden, it have gone hidden for very long time in Mizoram. I was just speculating. I have written one article also. You can just browse on the internet. Okay, maybe due to climate change in this recent era, the organism have just come back from the jungle to human civilization. Maybe we do not know what is the exact reason. Okay, so but this organism is prevalent in almost all states of India, especially Arunachal Pradesh, Meghalaya, Manipur, Assam, Tripura, and Mizoram. Nowadays, it is very prevalent. Okay, so this organism is transmitted by this is the scrub lesion, the eschar. You might have come across in public health. Eschar. This is called eschar. This is the site of the biting of the arthropod vector. Okay, so this eschar will be produced and there will be multiple organ failure. I have once discussion with one senior surgeon from Durtlang Hospital in Silot Hospital. He told me that in 2008, when they first come across, there was one patient who suffered from who suffer from some disease. They do not know what a disease actually is. So later on, they just did open surgery, and he told me that all the organs were collapsed. So he said I could not do anything. I just closed it down, and the patient and soon died very soon later than that. Okay, so this organism is really important, especially in northeastern India, scrub typhus. Okay, that is from human part, and in case of animal, anaplasma and Rickettsia are important. Okay, in today's class, I'll just have a few slides discussion in in anaplasma, and tomorrow we will just for 10 minutes we'll just have a look on Rickettsia. Okay, so anaplasma, when anaplasma, if you heard the name, it would strike one name of the disease known as gall sickness. Sometimes in America, they call it as yellow fever, and sometimes they even call it as yellow back in cattle. Okay, so anaplasma marginally. Another parasites in the in the genus is Anaplasma centrally, which is more or less the same, which is causing more or less same disease, but with less severity. And one more that is recently this organism was named from Ehrlichia to Anaplasma phagocytophilum, and in recent years, they could establish that the organism is capable of infecting human being, which cause human granulocytic anaplasmosis. And in case of animal, it is causing tick-borne fever or pasture fever. Okay, so anaplasmosis, as I told, the organism is widely distributed in almost every corner of the globe, in Central America, in North America, and in Europe, Southern Europe, Africa, Australia, and Asia. Every continent is affected with this organism. Okay, so the parasite is also transmitted by a diverse range of arthropod vector like Buphilas, like Dermacentor, Rickettsia, Hyaloma, and not only that, apart from tick vector, the parasite also can be transmitted by mechanically by surgical instruments, by contaminated needles that we will come and see. Okay, so anaplasma organism, you see here, this is the RBC, and in the RBC, the organism is located at the periphery of the RBC. Okay, so actually this is not a single organism. This is a clump of organism, clump, CLUMP, clump of organism. We call it as inclusion bodies. Okay, so these inclusion bodies, if you see under microscope, you can see around the inclusion body there is a faint halo. A faint halo, that means a faint whiter area. Okay, so that you can see, and the organism is located in the central, the peripheral portion or the marginal portion of RBC. That's why the parasite is known as Anaplasma centrally. If it is Anaplasma centrally, then it will be in the middle portion. Anaplasma marginally will be at the margin of RBC. You can see here those black dots. Okay, these are a clump of organism known as inclusion bodies of anaplasma marginally. For anaplasma centrally, many a times they will be located in the central portion. Okay. Anaplasma phagocytophyllum, I told you that there is another parasite which is causing disease in human being. In animal, the parasite does not cause much pathogenesis, but in case of human being, they call anaplasmosis, human granulocytic anaplasmosis. Okay, so this is the granulocytes, right? This is, what is it? This is neutrophil or eosinophils. This is eosinophils. If it is uh, eosinophils, there should be granules here. This is monocytes. Okay, so here in this is the lobulated nucleus. The this is the organism. This is the clump of organism. How do I differentiate? How do I know that this is not a the granulo, what is that, the nucleus, the nuclear mass, the segmented nuclear mass? How do I know that? Because there will be change in the color. This is dark blue and this will be lighter blue. Here also this sorry, in this, in the monocytes or in the lymphocytes also, the parasite also can infect, the organism can infect, and which will be different in color. Okay, so the transmission, these are the organisms from this infected organism. Tick will obtain, and they will replicate, and subsequently they will transmit. Okay, by the bite of a tick, number one. Number two, by mechanical transmission, by using surgical instruments, by using contaminated needles. Why? It could strike your mind that why the organism does not require any uh, transovarian or transstadial transmission. It does not require any transovarian or transstadial transmission. Why it is so? Because this organism, I told you that they are primitive organism, primitive, more primitive than protozoa. So there is no gametogony. There is no gametogony. That means there is no male gametocytes. Rather, there is no female gametocytes. So the organism is transmitted mechanically by the bite of a tick. Okay, mechanically by the bite of the tick, and also by the bite of the bunnet fly, or by mechanical transmission, surgical instruments, or contaminated needles, the organism can be transmitted. So the organism is very, very prevalent, I should say, or it's more prevalent during spring and during summer time. During spring and during summer time, the organism is more in number. So, okay. So if you see the pathogenesis, the pre-patent period is around 2 weeks to 4 weeks. Okay, it could be as long as 100 days. Here comes, just like babesiosis, in younger animal, more than, I mean, less than 1 year, or up to 1 year, or less than 2 years, the the organism, the disease is subclinical, or there is not much clinical signs and symptoms. But above, I mean, older than 2 months, 2 years, the disease will be quite severe. Here, anaplasmosis is characterized by, there will be progressive anemia. Okay, progressive anemia, and there will be lysis, extravascular destruction, meaning that the organism, I'm just going back to the slides. Okay, this RBC is infected with the organism. This RBC is not infected with the organism. Why there should be lysis? Here, the mechanism of destruction of RBC is by erythrophagocytosis. Some antigen which are released from the organism, from the infected RBC, are getting absorbed to the surface of RBC, and this, even the non-infected RBC, will be erythrophagocytosed by mononuclear cells. Okay, and not only that, there will be complement destruction. Number one. Number two, there is destruction of RBC by Okay, there will be destruction of the RBC. From RBC, from this destroyed RBC, there will be leakage of plasma protein. Oh, I mean, stromal proteins of the RBC. Okay, I'm repeating. This RBC is not infected. This RBC is infected. Okay, from this infected RBC, from this organism, there will be release of antigen. Okay, which are getting absorbed to the surface of non-infected RBC and infected RBC. Okay, so all these RBC could be erythrophagocytosed by mononuclear cells. Point number one. Point number two is that there is generation of autoimmune antibody. What is the meaning of autoimmune antibody? From this RBC, there will be leakage of stromal content of RBC. Okay, so against that one there will be production of antibody. Okay, so when this antibody comes, that means the antibody is against every RBC. The antibody is against every RBC, irrespective of infected or non-infected. So this antibody will target all that sort of RBC, and there will be total destruction of the RBC. Okay. Here, as I have written down, even the uninfected erythrocytes will be destroyed by autoimmune antibody. Okay, so if you see the pathogenesis, 10 to 13% of the erythrocytes are infected, but sometimes could be up to 65% of RBC also could be infected. So due to that condition, and due to that erythrophagocytosis, and due to generation of autoimmune antibody, there will be severe destruction of the RBC, then RBC count will be reduced and PEG cell volume will be reduced and hemoglobin will be released, and there will be jaundice. Ultimately, there could be macrocytic anemia. How do I know that this is macrocytic anemia? There are difference in the size. Some are big, some are small, some are pale, some are uh, some are a bit colored, some are a bit taking a deeper color. Okay, and some are having halo in the middle. Okay, so this shows that there is an anemic condition. Okay, so if you see the clinical manifestation, there will be a huge high fever, and the animal will suffer from, due to RBC destruction, the animal will suffer from breathless anemia. And when there is anemia, that means when there is lesser amount of RBC, there will be lesser circulation of gases exchange between the lungs and in the lungs. There will be breathlessness, and ultimately how the clinical manifestation it will be, cattle become extremely aggressive. They could become extremely aggressive. Okay, then subsequently there could be weight loss, and there will be jaundice due to destruction of RBC, and there will be uncoordinated movement, and due to that oxygen deprivation, the animal could abort, and there could be death. If you see the carcass, the carcass is icteric. The carcass, all the subcutaneous tissue and the fats will be yellowish in color, and the blood is thin and watery. There will be enlarged spleen, and there will be gallbladder distension of the gallbladder. That's why I told you that at the beginning, the parasite, the disease is known as gall sickness. And due to anemic condition, there will be leakage of serous fluids in the body cavities, and that all these conditions you can see on postmortem. Okay, so the diagnosis, historic, and the history and the epidemiological consideration you have to consider. Last year there was 2 cattle from our neighbor, that cattle breeding farm, state veterinary department, those 2 cattle died due to anaplasmosis, because those actually in the previous years they have imported cattle from Assam. Okay, so those imported cattle, they act as carrier, and last year when they have when tick have come, okay, so they infect, those tick have drawn blood from one cattle, that means from Assam, and they have passed the infection to the susceptible animal from those which are already having in this cattle breeding farm, and two cattle have died, and at last they have come for our help, and we could rule out that the animal suffered from anaplasmosis. Okay, so we have seen the parasites or the organism just like this one. Okay, so this epidemiological consideration also is important, and post-mortem lesions. I told you that there will be distended gallbladder, there will be icterus of the subcutaneous, the fat, and there will be fluid in the serous cavity, and all this body cavity, all this should be considered. Apart from that one, in Gemsa stain, this is what we can see around 3 to 1 micron in size, the inclusion bodies. The clump of organism can be seen in RBC, which is surrounded by a faint halo. Okay, serological test by using ELISA, IFAT, uh, complement fixation test can be used, and PCR diagnosis can also aid in the diagnosis. Okay, if you see the treatment, oxytetracycline is very effective by at the rate of 220 milligram single dose intramuscular injection, and sometimes they can also be used. Imidocarb also can be used at the dose rate of 1.5 to 3 milligram. In South Africa, I told you that I'm just going back. In South Africa, anaplasmosis is more, here it is lesser pathogenic. It is causing lesser form of a disease. So with the knowledge of this one, what did they do? They give a low dose of anaplasma centrally to animal, where there will be production of antibody and all this that gives an infection, protection against anaplasma marginally, cross protection. Okay, I'm reading down this one. In Africa, Australia, Israel, South America, infection with live anaplasma centrally is used as a vaccine to provide cattle with partial protection against the disease caused by anaplasma marginally. As anaplasma centrally is causing a lesser severe disease, so infection with the organism and controlling the organism by oxytetracycline. Okay, infection and treatment method give certain protection. Apart from that one can use acaricides like synthetic pyrethroids like deltamethrin, cypermethrin. You have come across. I'm sure you know that. And some tick vaccine. What are those tick vaccine? Like tick guard, like Gavak, and all these. They can also be used. And bush clearing, plowing, and also these are all important for controlling the disease. Okay. Thank you.